public-private partnership regarding cervical cancer. We're seeing this as a work. Currently, the facility is operating as a multi-specialist center, and that within 5 years, we will still dwell on the capacity of Kwabena, looking at Kwabena's huge patient portfolio, and then be able to kind of also cement our presence. But at the end of time, we are not in competition with anyone. But definitely our competitors will be the big one.
So, I mean, that's Dr. Kwabena Amo-Antwi, CEO of Walter Aiden Specialist Hospital, and he's also a consultant gynae oncologist. And like you just said, his center and his passion is to bring comfort to women who have been diagnosed of cervical cancer. He'll take us through like the whole gamut of the conversation. But it's good to know that you have options when you receive a diagnosis, multiple options. Second opinions are very important, and it's good to know that the facility is located here in the heart of Kumasi, no more than 5 minutes from where we are in the Kumasi City Mall. You may mistake it for a hotel, beautiful edifice. You may mistake it for a hotel. It's a beautiful hospital, and what more can I say? You have to pass by and walk in, and then acquaint yourself with the services. And like you said, they also offer a wide range of other specialist services. So find them on the Asqua Road, go there, and I'm sure they do a lot for women there and for the general public, but it'll be good to go there. Boss, so let's start a conversation on cervical cancer. Currently, what does the picture look like for us in Ghana?
As always, since the awareness began with the Japaigo project, which selected few institutions in Ghana, Sepedote, Kumasi South, Komfonoche, and Amasama Ridge Hospital was part of it. That was when the awareness started. Some of my lecturers and my professors were part of the. From that time, our numbers have been increasing because of just the awareness. There were times that people might have died way back and been attributed to witches and all that. But I think cervical cancer, if it's the only disease that ranks second to breast cancer, then it's quite a public health nuisance. But my take on that, even that arrangement, has to do with the fact that a lot of awareness has gone on with the breast cancer. So if cervical breast cancer is leading in terms of numbers, it could just be the awareness. Know that if a woman have a disease with a breast, it's something in front of the woman. But a lot of people will also brood when they have issues within the shame area. So it's not like say out of place for people to kind of count breast cancer as a leading cancer in Ghana. For me, it could be cervical cancer. The picture is as bleak. I don't know how many of cervical cancer cases that I've seen, like hard figures. But let's say if I have 10 patients who are diagnosed with cervical cancer, 7 of them is already advanced. And if I have 10 cases confirmed as cervical cancer, only, only 4 will live up to 4 years. Yes.
Only 4
will live up to 4 years, and those is a paper you can find on the internet. That's my publication on cervical cancer in Ghana. Okay, and this is just not to do with Kumasi. It's so representative in the sense that it's a research between Kwabena and Komfonoche. Yes, and there are a few interesting findings on the cervical cancer, which, to me, we need to make a lot of noise.
No, but these numbers are staggering.
It is.
Because that's about 70%.
Yeah, will die within the first 4 years.
Is it because we're finding out late, or we're not screening, or we're not conscious of it at all?
You see, the causes are multifaceted in the sense that, in the well-established societies regarding those that have enough money to set up systems to kind of control the condition, in the last 50 years, successes have been intercepting the pre-cancer cancer sequence, getting to know them in early stage and treating them. That's all the West has been doing. Okay. If that has not been your, let's say, your models, then it means that you will never be able to fight the disease. These are tried and tested. avenues or modalities that have helped in the fight against cervical cancer. Looking at the fact that kids are being given injection, to prevent the wild type infecting them. Those that have already been, let's say, exposed to, would want to pick the changes in the cervix very early and treat them. And those that have the disease itself are given certain, let's say, quality care. And apart from these things, I don't think there are any other ways of getting to kind of meet the disease squarely. But the fact is that, are there any structures within the country that seek to kind of emulate or replicate those?
So if I'm hearing you correctly, it means that like there aren't many, if any, channels available for people to effectively screen and get treated within Ghana. Like, okay, so for someone who is listening, who is not in the health field, how many options are available for someone who has a diagnosis of cervical cancer across Ghana? Like, what are their options?
Yes, if I let's say I diagnosed you of cervical cancer, and let's say whatever we do is discussed at the level of tumor board. It's not just a single person who decide what person is treated with. But the fact is that once majority of our diseases are advanced, then radiotherapy becomes just the most important central treatment parameter. In a sense that, as I speak to you now, we have issues with, the treatment of the bulk of these diseases. Okay, and the next will be those that are diagnosed very early to have surgery. If you have the capacity for surgery, it's only Kwabena and Battle. Okay, and water aiding is also proud to be counted among the stewards.
So I'm counting 4.
Yes. It's not even enough. The capacities are not equal. It's just like the fingers. Okay. The capacities are not
Kolebu, Konfanoche, water aiding and Bator,
yes.
These are all in the southern part of Ghana.
Yes.
So if you cross Kumasi and you head BA, nothing, northeastern, nothing.
Yes. And that's the sad aspect of the story. I would always advocate that if this is the most common genital cancer, in women, as part of treating every woman at least who is 35 and above, just have a look at the service. You may see something suspicious, because already there are not much being done in terms of, let's say, implementation. Although we could have all the nicest policies on paper, none of them being translated into veritable projects. So. And then in terms of the screening, there are, there are thousands and thousands of, let's say, facilities in Ghana that are doing the screening their own way as to whether it's in tandem with what current recommendation or whatever. But I think it's an effort that we can also, let's say, applaud. But we need to also be united as a country. There should be a systematic program, that will, let's say, coordinate.
Yes.
If the coordination is right, then it's possible for us to kind of use even minimal resource to do that.
So, if you're just tuning in, like someone just did and is texting me, it's the Orange Health Lounge, and we're on 107.9 FM, and we're talking to consultant gynae oncologist, Dr. Kwabena Amo-Antwi, and these guys are at the forefront, literally, of cancer management in women in Ghana, and he's painting for us a picture of what it means to say you're going for cancer treatment. And the options are not many, but it's good that we're able to point in the direction of somebody who can offer you an option. Our show is live and interactive on YouTube, and we're also on WhatsApp if you want to join the conversation via text or by audio, 0548-501-584, and we'll definitely give you that opportunity. Good morning to MC Portfolio. You're listening to us live here in Kumasi. Thanks for joining us. Good morning to the members of the Society of Family Physicians of Ghana who are also keenly following the conversation, and we're glad. So, boss, let's drill down to the basics for those who are not medically inclined.
Okay.
What is the simplest way to say cervical cancer is, especially in our environment?
I would say, you see, there's something that a lot of women gloss over. You have a vaginal discharge. At times, this vaginal discharge will be tinged, or let's say mixed with a bit of blood. That could be your first sign of cervical cancer. Okay, as the disease get into the body of the mouth of the womb, and then it will start eroding vessels or carriers of blood, and then the person will start having a bit of bloody discharge, whether it's with or without sex. There are times where women say, when I have sex with my husband, I see blood, or I see, let's say, blood on my sanitary pad, or let's say on my tissue when I wipe myself. These are all could be signs of a cervical cancer. And one thing I need to tell you is that if you're someone over 25 years,
okay,
and you've never had an opportunity to screen, or you don't screen, you screen but you don't do them frequently, that is the greatest risk factor for cervical cancer.
35.
25.
25.
If over 25 years, and you've never screened for cervical cancer, or you do them infrequently, that's the greatest risk of cervical cancer. It has nothing to do with your sexual promiscuity or blah, 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 as people used to parade and all that. I mean, that is not a point. Okay. If you've never done that, that is the greatest risk of cervical cancer.
It's really good that you've just mentioned that, because someone just sent a text on 0548 50158. That's our text line. And what she's saying is that everything I have heard about cervical cancer has got to do with early engagement in sexual intercourse. Kindly ask your guest if that is true.
Yes, you see, for us within the Afro-Caribbean race, you see, there are two events that are complacent in this, issues. Okay, one, early age as sexual intercourse, and then pregnancy. And we seek to do this often in our lifetime. That is okay. The white goes through the same thing, but they are able to kind of pick the pre-cancer cancer sequence. They intercept it so that you don't get to have the cancer. But we don't have anything to do that. So our bane has to do with early, debut or sex, having frequent pregnancies and carry them to term, having them in our or what runs through all these things has to do with the exposure of the HPV virus. So long as you have sex, you're gonna get exposed to the HPV virus. Okay. So to some extent, it's time to reason. If the person said, it's all about having, let's say, early sex and all that. No, I see them as a huge stigma, because already, there are a lot of things going on within our community, and that there are other better ways of intercepting the cancer rather than, condescending and making it look so. But to me, that is not it. Okay. Contemporary understanding of what we do as people, there are several ways. Okay. The world is here with us in terms of sophistication and people getting exposed to a lot of things. But what can we do as people with a new resolve to, be able to fix this issue? It has nothing to do. But hey, this is the encouragement. Let's keep kids and girls at school. Let's get them busy. It reduces their level of involvement into sexual activities, which get them exposed. If they are already sexually active, let's introduce them to condoms. Okay. And for those who've had it and they are now over 25 years, let's make sure at least we have a look, screen them. Okay, either with the HPV or the PAP. But I would recommend the HPV test. Okay.
But we'll come to HPV test in a bit. And thanks for joining us. If you're just joining us on the show, we're talking about cervical cancer. And in January, the world over, we focus on cervical cancer and raising awareness. Not just awareness alone. We also go a step further and point you in the direction of where you can find and get help. According to the WHO, there are over 600,000 new cases every year. That is more than 500,000 cases every year. So if you say, okay, from 2000 to now, you're looking at over 2 million cases of cervical cancer. Ask yourself, if you're a woman, if you've ever been screened, or it has ever crossed your mind that this that I'm having could be cervical cancer. So besides the vaginal bleeding that women may experience, after intercourse or between periods, and the vaginal discharge, and then the pain during sex. Someone wants to know, is there anything else? Because, okay, so let me read out her question. She's saying that she's over 30, she's never been screened. I don't have any of the symptoms that Doc is talking about. Can he tell me why I should screen?
Yes, I guess I need to get clearer with my submission. You see, the peak age of HPV infection is around 35.
Okay.
In Ghana, based on the research I did with my colleagues, is bimodal. Around this time is the highest, and then again it takes off again around 60 years. Mm-hmm. The fact is that if you have an HPV infection, it doesn't give you any sign. It gets to do changes that is within the cervix, but if you are immunocompetent, you don't have HIV, you eat well, and those kind of stuff, the body is able to clear them. But some of them may persist. When they persist, you will show no sign unless we use a magnifier to look on your cervix or take cells from your cervix before we can see any change. So it has nothing to do. The conversation was about those that have cervical and established disease.
Okay.
If you have the cervical cancer, then you're going to have the vaginal discharge, you're going to have, let's say, vaginal bleeding. But there are quite a number of them that will also come to it. They've never had any of these things. They went for screening and accidentally they were picked to have the disease. Okay. So these are the models.
Good morning to all the nurses and midwives who are listening. Thank you very much for joining the conversation. You can also join us on 0548 501 584 by text or by audio. So one of our regular listeners who's a midwife is asking that, can you elaborate about the opportunities for screening? Because what she's saying is that, she says, I do realize that a lot of women are uncomfortable with cervical cancer screening as compared to breast screening. Saying that as a midwife, I can count how many people have opted for cervical cancer screening, even amongst my colleagues. She's saying that for her as a midwife, what opportunities are available for her to screen people?
I think that it doesn't take much of, let's say, a lot of, it's not a rocket science. You can't just be trained to pick the samples and you'll be fine. The most important thing that we're looking at the service and the layout of the service. The service is saying if you want to kind of clear the service as to not to have a disease or have the disease, you should pick a bit of what cells from the outer part and inner part. And it doesn't take much to teach someone how to do it. And one of my colleagues around Bathor, I guess, has been on the forefront of those, where even nurses and then, let's say, health workers from the CHIP compound through the district up to regional hospitals have been trained to do that. So I guess it could be taken at the level of what the facility, but believe me, not everyone will sync with you regarding, establishing the capacity for those activity at the facility level. But that notwithstanding, I guess, there are quite a number of them. Okay, Konfonoche Family Planning Unit is a seat for the screening in Kumasi. Water Aiding also screens women within Kumasi. Kumasi South screen women within Kumasi. And then Menchia also does the same. And these are hospitals, I guess, I'm aware of the capacity within these hospitals to be able to do these things. One thing has to do with the fact that if you could have a bit of policy driven, facilitations, okay, and that probably can be something that the headship within the institution can help to establish these capacities.
So if you're listening to us on Orange FM this morning and you probably run a school, an institution, a business, there are women who are above 25 or below 25 who are there, and you've never really thought about what can I do to make their lives better. One of the things you can gift them is a cervical cancer screening. It's a gift of life, literally. It's a gift of life, literally. And like Dr. Kwabena said, he's available to help you do that. And it's important that we offer some of these things to people. I mean, gifts are good, but health is much, much better. Thanks for tuning in. This is the Orange Health Lounge. We're on your radio every Saturday from 8 a.m. to 10 a.m. And every week we bring you a health discussion, something for you to ponder and something for you to take action on, especially as the new year starts. And this morning we're talking all about cervical cancer, and it's important that we listen and we take notes from this. The options are not that many. Good morning to you, Mami Sewa. You're listening to us and you're saying, so what entails cervical cancer screening? How is it done for people? I have never had the opportunity to screen, and what are my options? He's saying I'm 36. So, but how is it done for somebody who knows the cervix is inside? They are wondering, how are these people going to screen me?
Yes, when you come for the screening, the procedure need to be explained to you in a sense that no one would want to kind of have her shame, no woman would want to have her shame area being exposed. But the fact is that the gains after the procedure is quite enormous. We'll put you let's say we'll put your back on a table and you'll say a little bit.
I know.
You lie on your back with your legs suspended. But as I said, this is not a comfortable pose for a woman. And it's all about trust, and it's all about the fact that this is what I intend to gain from this. And then we'll use something that looks like, let's say, the beak of, let's say, a bird to expose or to make your cervix visible. When we do that, at times we may use the light to magnify, light to kind of make the whole place, let's say,
it's a deep area, so you need light.
So that the place become. Every little details is seen when the place is well illuminated, and then we'll use something like a spatula, the ice cream scoops, to just gently go around the cervix and then a bit in the cervix, and then put it on a slide. Or we use a brush. It's a very small brush, you can't even feel it. It's not painful. All that I'm talking about is not painful. But it's just uncomfortable in a sense that no woman would want to have herself in that position. And then we also can rub it around the cervix, and then put them in a special fluid. So when you have it in a special fluid, then you can test the HPV DNA.
HPV DNA?
Yes. The DNA is just to tell you that every cell in the body is, every individual is unique. And we are unique in the sense that we have different DNAs. The same way we're different from the virus because we have different set of DNAs. So now, if you see this DNA, then you can say, then it means that this HPV organism is here. So if the HPV organism is there, then we'll look at whether it's the bad one or, let's say, the friendly one. So I think the process of screening is just uncomfortable. It's not associated with any pain. But I think that one important thing has to do with the fact that the person needs to be cancelled on the gains, not just to do with being exposed. The reason why I feel strongly that we all need to be teetering towards the HPV DNA testing has to do. You can even put, let's say, a cotton bud, in your PP yourself, and then put it in a special fluid and send it to the hospital.
Really?
Which we call the self-sampling. So it's possible that very soon we will be giving out a lot of receptacles or containers to people. Just go do your thing and then bring it back for us to, But one important thing about tests is that as whether the thing was adequately taken from, the China, but I guess.
So there's an opportunity
to do
self-testing.
Yes, self-sampling.
Like self-sampling, and then you send the sample off
to maybe a designated.
There's an opportunity. And that would sort of
Yes,
remove the
that,
discomfort associated.
the discomfort bit.
Okay.
We understand perfectly, but you see, as it looks like, once we have it on policy, it's not being implemented. There's not so much noise. It's just individuals and a constellation of people who are doing what the education of cervical cancer. But if it's coordinated, I guess we could also rise and then be able to kind of down this issue of discomfort and a bit. Because to me, even the age is dropping. Those, people with the disease is not dropping.
Okay.
The age at which the person
you can come with.
The age at which the person is first diagnosed to have cervical cancer is not dropping. And when I started my training, often the mean age is around 52. Then quite a number of them were entering the 40s. Then I can tell you, as I sit here, I have a 34-year-old girl with full-blown cervical cancer.
34.
34.
Wow.
Okay, which, this is not an HIV positive person. Okay, and we're looking at real grim picture, and we need to sit up and then do something as a country.
All right. If you're just tuning in, this is 107.9 Orange FM, and we're on the Orange Health Lounge. My name, as always, is Dr. Jima, and we're discussing cervical cancer with Dr. Kwabena Amo-Antwi. He's a gynae oncologist. He has many alphabets after his name. many alphabets are behind his name. Those are all academic. So, yeah. Good morning to you, Frederick Osei. Okay, so I think that's OJ. So he's asking that, so it's a three-part question. So let me ask the first one. He's asking, how accessible is HPV testing, and is it expensive? It's like within Kumasi.
Within Kumasi, I guess the one important place to come to is water aiding. Okay, and then again, currently we also running the project.
Okay.
And that project, more or less, we're doing an artificial intelligence project on the service.
Okay.
We would want to kind of establish a repository of all cervical images, and those things come along with the HPV tests.
Okay.
So the program is seated at Konfanochi, the family planning unit.
Okay.
Menshia.
Okay.
And then Kumasi South.
Okay.
So these are the institutions. In terms of affordability, these are places you could go and then have them done for free. We call them the AVIMAP projects.
The AVIMAP project.
Yeah, the AVIMAP project.
So you're taking pictures of
the service.
All the services.
Okay. Services that come our way, we targeting about 4,000 of them.
Okay.
So when we're done with the service, the pictures, then we will look at the service individually and find out whether there are issues at any point. And what we see, then we machine learn them. So that you could be at a Biokuta, Kinkenso before and pay you with a very low-tech technology. Take a picture of a service, maybe with assistant of what the chip compound person, and then we match them just like what we use in crime analysis for DNA.
Wow.
And then be able to say, hey, it's like
this
I have this condition.
Yeah, because the point is that the avenues to screen are sort of skewed to urban areas. So if somebody is not within an urban area, it becomes very difficult to assess it. Wow. Are there any, risk factors? There's a very popular myth that I want us to clear up. So shout out to, his name is Bless. He's saying that one of the things I've heard with cervical cancer has got to do with a woman with multiple partners, or women who have multiple partners. Is it true, and how do these multiple partners contribute to cervical cancer?
Yes, cervical cancer is essentially infective in origin. HPV virus.
It's infective in origin.
Yes, infective in origin. You need to pick it up from
someone, from a man
or a woman. That's it. It's just the issue of the chicken and the egg. Who came into the discussion first? You understand? So either you pick it from the woman or you pick it from the man. When you have it, so it's sexually transmitted. You could have the HPV infection other ways, but for us concerned with, let's say, cancers of the throat and those kind of stuff, it's often through sexual contact.
So it's transmitted via sexual contact.
Yes. virtually. You see, you know that it's not penile vagina only. People do
other stuff.
You understand? You understand? And people's sexual orientation is changing by the day. Looking at it,
It's crazy.
And that's the reason why you need to think about. You could sexually be infected, and you have the seat of the infection in your throat, in your mouth. The penis will have it. Okay, the anal region or the anus will have it. The cervix will have it. So these are all part of what the various sites which you could have the exposure. But I should always, this is what my discussions of late are trying to demystify. It's true that the prodrome of the cancer just has to do with you having a contact with the HPV infection, especially a contact. So, which means that in what way would you have a contact with the HPV? A sex. So if you have it more, the likelihood, mass effect, you have it more. So issues to do with, multiple sexual partnership or being in a sexual relation with a cohort or a consort who have other multiple sexual, then you are likely to have more of this infection, and that is it.
So you are likely
to have more of this HPV infection.
More contacts with people who are
carriers of the HPV. That is it.
Okay. So it's not cut in stone. It's just that you are more at risk.
Yeah, you are more at risk. And you see, even the fact is that the reason why I keep on kind of trying to kind of make this one not really a strong point has to do with that. A lot of people are having sex at younger ages. So our focus, and a lot of people are also having sex. People are seeing sex as a waste to the means now in this contemporary life. Okay? So we could also shift and then have a focus rather on how do we intercept the changes that are caused by the HPV. That is more important. Okay. We need to know now the most important risk factor is that you've never had a pap smear or HPV test, or you've had it infrequently. You don't have it often. That's the only and the most important risk factor. Don't talk about multiple sexual partnership. Don't talk about early debut at sex and all that. The fact is that if you're 25 years and above, and you've never had any screening, then you are the most important person when it comes to cervical cancer. You are likely that you may be brought in the condition.
Wow. Good morning to you, Saint Anthony of FWACS. Interesting name. He's saying that can cervical cancer be transferred through oral sex? This is a very popular question that comes up.
It's service. It's service. And this is what oral, truth. There's a version of the HPV disease in the truth. Okay? You can have the cancer of the truth caused by HPV. You can have the cancer of the mouth caused by HPV. You can have a cancer of your penis in the truth caused by HPV. So you understand? It's a whole. We've realized that HPV is very, let's say, ubiquitous when it comes to cancers of the body.
This conversation makes you ponder, doesn't it? We're on the Orange Health Lounge this morning. My name is Dr. Jim, and my guest is Dr. Kwabena Amo-Antwi, CEO of Walter Aiden Specialist Hospital, one of the few facilities in Ghana, I won't say in Kumasi, in Ghana, specializing in gynae oncology. That is cancers that have got to do with your whole gynecological area. And like you said, the most important thing is that you have done the screening if you're above 25. So if you're listening to me, you're going to hit 25, you're above 25, you have not even thought about it, then you're at risk. So like you're saying, don't think about the things about, early sexual encounter and all those things. If you're a woman, you're above 25, you've got to screen. You've got to screen. There are other facilities where you can go and screen, of course. Menchia Government Hospital, Kumasi South, Atunsa Gogo Hospital, Asante Mampong Hospital where I work, Konfanoti Teaching Hospital Family Planning Unit. I think Mankranso Government Hospital also runs a screening program. And yes, so someone is asking, is screening free? And if it's not, why isn't it free?
I'll hate it as it is. We are not serious as people. You see, you can see a lot of V8s moving around.
Plenty, especially today.
Yes, you understand. And these V8s can screen a lot of people. Our priorities as a country, I mean, to me, is displaced. And it looks like the emerging, let's say, population, what everyone is cading towards politics. I want to be a politician because that's where we can.
That seems to be the easiest way to make money.
We will plunder the country. So whatever we need to kind of use these monies for, we will not be able to. And that's the reason why our women are dying, because we can't have them screened. How can Rwanda be able to set up a proper screening for cervical cancer? I was in Uganda, I was in Malawi, and we were the people who give them the knowledge for their onset. Okay, and in Ghana, that was 2013. I was in Uganda.
And they have used your ideas to set up a screening program. And we are sitting here.
And we are sitting here. We are the people with the human resource. And that is how. Last week there was a project in Accra on cervical cancer. My boss, Dr. Kone, Edu Pierre Kobe, my contemporary when it comes to these things, none of us was at the project. And he realized that. So in as much as things are not coordinated, there will be what on let's say undue replication of efforts. Okay, and this is where it need to be seated within policy by the government.
So is there a cervical cancer screening policy? Like, does Ghana have one?
We have one.
We do?
Yeah, we have from 2016. We have one.
Hey, this is news to me.
We have a screening policy.
We have a cervical cancer screening policy for Ghana.
I'm telling you.
Wow.
And the document is still lying there. Okay, so let me give you this thing. I've been able to geospatially analyze where every cancer is coming from within Ghana, in a sense that they come to me. So I based on the referral institution and where you live, we'll be able to, and then we know where is dense and where we need to kind of, and we can tell you from Ghanaian Onco unit in Konfonochip, where even there's a likelihood of a second institution within the upper part of the country. And you ask yourself, who knows more about these genital cancers in Ghana than these people? So if a government, or let's say a government facilitated in any way to have a meeting, and these people are not among,
and you didn't call them.
You understand? And this is what at times people will say, hey, why don't you let them know about what you guys are doing? The data is there. There's, let's say, record department, informatics. So do they want to say that they don't know the number of cases being done out of the number of cases being done out of? And these are some of the issues.
So for those who don't, what he's saying is that they've been able to use a lot of data, to map where in Ghana the cervical cancer cases are coming from.
And then some come as far as Burkina Faso.
And that should be able to inform where we should set up like cervical cancer screening
programs.
And this is not being used.
Yes.
It's a shame, isn't it?
And you see, this thing, I guess, is coming out of the dismarry between the Ghana health system and the teaching hospitals. I guess we need to kind of coordinate better, when it comes to these kind of social interventive programs.
Yeah. Because I'm surprised to hear that there's a cervical cancer screening policy. Good morning to all my friends who are listening to us from the Ghana office of the World Health Organization. Thanks for sending the link. I will definitely read it. Good morning to you guys. It's interesting to know how far sometimes our program goes, and it's good to know that someone is listening. So there's a question here about vaccination. It says, can you ask your guest? I hear vaccines are available for prevention of cervical cancer. My question is, are these commonly available anywhere? And I've been told that it is quite expensive. Can he talk about cervical cancer vaccination? So someone is pushing us there.
Yes, the vaccination is done within the country. I mean, there's also a whole kind of twist around it. We'll get to the twist, but let's
But
start.
it's available.
Yeah, it's available. But I mean, ordinarily it's a bit expensive because there's no government subsidies on that. Let me.
It's not subsidized by government.
I have no clue. I have no clue whether it's done in any policy paper. Now, I used to kind of access these vaccines, okay, from what's the name? Pharmacy around sometimes around about.
Sometimes around about.
Yes, sometimes I've forgotten the name is not coming up. Okay, then I mean, less about 2-3 years ago, a shot would have cost you about 2005 or 2006.
CDs.
Yes. 2,000. No, 250. Sorry, 250.
250.
Yeah.
Okay.
And you need about 3 of them. That is just even the vaccine that contains only 2 strains of the cancer-causing agents, the 16 and then 18. And I can tell you, the one who asked, there's a publication which I did with my on the system. We are telling you that even apart from that, there are other strains in Ghana that are even not within the vaccine. There's a whole kind of paradigm shift that we need to go through if we need to be serious with cervical cancer. We've realized that even the ones causing the papilloma, that is not what is common in Ghana. But that is what is within the vaccine, the Gardasil. The 11 and 9 is not common. It's rather the 42 and 43. You see, and at times it makes you feel a little bit. I mean,
the 11 and 9,
which
the HPV
vaccine. We have 2 vaccines on the market
in Ghana. Okay.
I don't patronize the Gardasil. In a sense, it's quadrivalent. That is, I have 4 strains in there. Okay. 2 targets the most important causes of the cancer. That is 16 and 18.
Okay.
And then we have also to prevent FWACS and all that. That's the 9 and 11. Okay. That is provided within the Gardasil. Now, we've realized that the vaccines that are available within Ghana, okay, can only give us about 62 and 67 percentage coverage for the available strains within Ghana.
So why do we have those strains?
You wait, because we are different. The Afro-Caribbean race is highly heterogeneous. So you cannot discover. For example, what is here? We realized that the 16 was giving a certain protection for the 31 and 33, which are also high-risk strains. But they are not in Ghana. We have 35. For those that are even without cancer and those with cancer, 35 is there.
In Ghana?
Yes. 52. For those that are without cancer and with cancer, they have 52, strain 52. And you realize these dynamics are different. We need to kind of open a huge discussion on these factors. Okay. So now, someone will say we are going to Gavi, Global Alliance for Vaccine Initiative and all that. What are we presenting to them that these are the uniqueness of our situation we have on the ground?
So there are
the puzzle. We've not even started.
But okay, so there are vaccines available in Ghana.
There are vaccines available. Okay.
They
target the most important cause of the irrespective of where you are.
Okay.
The 16 and 18, that's okay.
Okay.
Yep. So we have the Cervical and then the Gardasil one. Okay. And then now on the market is also non-valent Gardasil 9.
Yes.
If Gardasil 4 is not affordable, how can Gardasil 9 be affordable? Okay. Cervical, which contains only 2, is what to me I tend to use because the 16 and 18, irrespective of where you are on those planets, will give you a certain level of coverage.
Of protection.
Yes.
But what about the age that she asked about? If someone is listening, they have a young child, female.
Yes.
At what age should they be thinking, okay,
you see, the recommendation,
I can vaccinate her?
Yes, the recommendation is from 9 to 15. And then we could do a catch-up. So long as you know that I don't need to, let's say, examine the person that the person is a virgin before I give the vaccination. But at the end of time, it inures to the benefit of the person to be frank with us. And there are a lot of what I think are pitfalls.
But 9 years?
No, I'm talking about 9 years to 15.
Okay, so from 9 to 15.
Yes, so this is where I think that it will be as practical as possible. Where are they? They are in upper primary
Yeah.
and then lower.
So 9, 15 is, let's say,
JHS.
class 4, class 5.
Yes.
to
So let's say
the-
classes.
Yes.
Let's our target be classes and JHS
JHS
1.
1.
So by at class 6, we give all our girls the vaccines. Those that skip, that we repeat them
In
at
JHS
1, and that is it.
How many times do they have to get the shot?
There are 3.
3 times.
Because for all immune response, the first
Yes.
one, the second, you get,
Yes.
the booster gives immunistic response, and
Yes.
that is it. But the issue has to do with the fact that a lot of even parents are cold feet.
No, it's because their parents listening,
Yep.
and it's because they don't understand
Because
why their
their
10-year-old
girl should
girl should have a shot against cervical cancer. Oh, she's too young. But if you're a parent and you're listening, GSS 1.
JSS 1. To me, I think that all primary sus girls and primary JSS 1 should have it.
Yeah, but for me, I think that's a really good target. Because at class 6, before you go on to the junior high,
You should have had.
you should have your your cervical
Yes.
cancer vaccination.
Yes, please.
3 shots.
Yeah, 3 shots.
What is the average cost for that? If someone is listening and they're interested
It will be difficult looking at shortages in the global supply chain to
Okay.
give a figure now.
Okay.
But I think it's something that we could make available.
Available.
I mean, to me, Ghanaians are not poor. But
No,
it's
no.
how we model the stories.
From what I saw in December, Ghanaians are not poor.
Ghanaians are not
We know how to save towards things.
poor. Yes. So
Because-
we could do that. We could save
Yes.
that. Yes.
Right, and the people who are saving towards Kwewu.
Yeah.
In Easter, people are saving money.
Yeah.
So if you've got a girl child, think about her future and save some money.
Yes.
So that by the time she's transiting to JHS, and like Amo-Antwi said, even if you bring her, between 9 and 15 years, they know how to. They're not now going to ask her if she's had
No.
sex. Okay.
We have a way.
Okay.
We have a way of doing that. That's our work.
Okay,
You understand?
yeah.
And you see, people will think that this is the time where we're going to kind of break the cradle in front of the parent about the sexual activity. But no, it shouldn't be like that. Okay. You see, for us, we're looking at having a hold on this lady girl for the rest of her life.
Yeah.
There's no way. And I bank so much of my work on on the trust I have from the woman. Okay. So this is the time for me to have this girl and be able to kind of follow her through her development. So there's nothing like that. When it comes to the healthcare, there's a way to engineer the art regarding this kind of young girls and all. Yeah. So I think that that's where we need to stakeholders. I don't even want to use the word stakeholders because it's been 1,000 over and over.
So you the parent.
Yeah, the parent
who has turned on
the headmistress or the headmaster
master. Yeah.
of our first and second, our first cycle,
First cycle institutions.
Let's target the
Class
classes
6.
and the JHS.
I'm sitting here wondering why this is not like a cast in stone policy.
I have recommendation online, okay, on one of the tests. Ghana Health was probably the Ghana Medical Journal. I have 2 of them, okay. I have a work on the HPV detailing whatever we intend to do. And you asked me, there's a program that had gone on the last week.
No, but that is a shame.
Yeah.
That there's a national conversation
Yep.
on cervical cancer, and the individuals who are at the forefront of the whole thing
I know you've been
are not there.
And you know that when something comes up, it's virtually the Ghana Health Service.
Yes, the Ghana Health Service controls about 70% of
it is.
the healthcare population in Ghana.
And the fact is that when it comes to cancer management, it's domiciled in where? In a tertiary institution. So why can't we create a link between the two?
We definitely can. If anybody is listening to us from the Ghana Health Service, please, let's just talk to Dr. Amo-Antwi. You can find him. He's not difficult to find. You can find him. And let's have this conversation, because transiting from class 6 to JSS 1, that should be our catch point. The burden for cervical cancer is increasing globally and locally. So why not create a program that gives young ladies, that gives girls the chance to prevent future disease? If you're just tuning in, this is 107.9 Orange FM, and we're on the Orange Health Cloud. It's 9 minutes past 3 o'clock here on Kumasi's Music Leader, and we're on Kumasi's #1 radio health talk show. This morning, we're talking cervical cancer. We're making sure all the issues are laid bare. We're answering all your questions on 0548 501 584. 0548 501 584. That's our WhatsApp line. You can send it as a text, or you can send it as a voice note. I'll definitely play it for you. Just keep it brief. It can be in English or Chi. I don't mind. It's important that we have these conversations, especially about preventive health. Doc, so vaccination is important. Vaccines are available. They do not cost an arm and a leg. Just plan towards it. So a listener wants to know, she's saying that since I'm 30, can I still get the vaccine? Saying that she's 30, can she still get the vaccine? I think she'll prefer the vaccine to the screen.
Okay, the whole thing has to do with at 30. It depends on whether you've had your sexual diabetes. Okay, so what I can say is that are you married, giving birth?
Most likely,
if you're married and giving birth, you can have the vaccine.
Oh,
yes.
If you are married
and giving birth, you've married and giving birth or giving birth, you can have.
You can't have the vaccine.
Yes, because I don't want to go to the point that you've had sex before. Mm-hmm. Every married person, let's say.
Now you don't even need to be married.
Yeah. And let me be more serious on this. You see, the mechanism of preventing the disease, we have isolated a very mild form of the condition into a vaccine that we give to you, and your body will mount up soldiers. So when you meet the real ones, the soldiers will fight against them. So if you've had sex before, you've met the wild people already. So they are in the body. The vaccine cannot do anything to protect you. Yes. And there's something I needed to talk about. I don't talk about those kind of, let's say, the statistics that are being peddled around by the world, this, that. Let's say, I see between 120 and 140 cervical cancer cases every year. Kolebu sees up to like 160 every year. I don't know how much the numbers that goes to Swedish Ghana Medical Center. So we're looking at about close to 500 cervical cancers every year. And when they come, majority of them are stage 3 or stage 4. Let's say it's stage 1 to stage 4. Majority are stage 3B up to 4. And I'm telling you, when you're like that, only 4 of them will live after, let's say, 4 years.
Only 4
of them will live after 4 years. Let me also give you a reminder. When we started this whole project about cervical cancer, we used to operate a number of them, but we realized that upon establishing a repeater capacity for the treatment, majority of them even don't meet the standard of what? Surgery.
Okay.
If you are advanced, we can operate you. But based on the fact that we've had a lot of what capacity to be able to review the person really well, have a good pre-treatment assessment, we can operate majority of the case.
We can't operate majority of the cases.
Yeah, that comes in a sense that they are all coming
late.
I can't remember whether in the last year I've done any radical hysterectomy on cervical cancer.
But that's alarming, isn't it?
Yeah, and that is how grievous the situation is. So if you meet people, let's say, being followed by serene, military, police, kind of say, motorcade, and then you get sick.
But so there's a very controversial question someone is asking, and I think that this question makes a lot of sense. She's saying that a lot of the middle class and elite, I didn't think we had class systems in Ghana, but there we go. She says a lot of the middle class and elite people can afford these vaccines that doctor is talking about. However, a lot of poor people cannot afford these vaccines. Saying, are there cheaper forms of the vaccine that doctor is talking about so that poor people can afford? Because I'm thinking that it's a lot of poor people who engage in sexual activity very early.
Yeah, that is true. You see, when we come to these big companies, they have a way of protecting their products, but I guess generics may be available. As I talk with, probably in India or something like that.
Most definitely.
Yeah,
okay.
But I can tell you, they are into take their money out. But one thing, now I heard that, we'll very soon be be producing vaccines in Ghana.
Yes.
The fact is that...
It's just like those vaccines are not... the vaccines that we produce in Ghana are not these ones.
No, it doesn't matter.
Okay.
There's always a patent available somewhere. Probably we can contact the innovator that we need to kind of make our own type of... Mind you, as I keep on emphasizing that the strains is region specific. Okay. So we should even be moving towards the trajectory of what? Making sure that we're targeting the ones that are available in Ghana. And that would require that probably we set up an in-house, like say manufacturing or kind of thing.
You're listening to 107.9 Orange FM, and today we're having an insightful conversation about cervical cancer. I'm taking my time to take you there to understand why it's important that you give someone the gift of cervical cancer treatment, screening, or awareness. It's important. And if you haven't learned anything today, according to Dr. Kwabena Amo-Antwi, class 6 should be that point where parents, guardians, school owners, churches, you are gravitating towards making sure that these kids receive vaccination before they pass on, like they go on to the GSS. I think that's a really, really important point, because class 6 is like a transition zone of learning, and that can help us. That can help us. Good morning to you, Jigwaji. You're listening to us all the way in Accra on DAB, and that's fascinating. Orange FM is live on DAB as well, so you can listen to us live in Accra and Kumasi simultaneously. If you have a DAB device, we're also streaming live on YouTube. You can go on YouTube and type in Orange 1079, and we will be there. And you can watch us live and put your questions there. So, and the WhatsApp line is also open, 0548-501-584. We're giving you options for you to be able to listen to us, for you to be able to interact with us. And Jigwaji, thanks very much for your question. So, she's saying that are there types of cervical cancer? Because she has heard you say type 3, and so she's asking, are there types of cervical cancer, and are some more dangerous than others?
Yes. Let me comment about what I said about the stages.
The stages.
You see, for you to have the cancer comes in stages as 1 to 4.
Okay.
And the lower the stage, the better the outcomes when it comes to treatment or your options to treatment. Okay. Now, the cancer itself comes in 2 types.
The cancer itself?
Yes, we have the squamous carcinoma and the adenocarcinoma.
No, this one.
But these are not things I need to talk about.
No, this one don't the eco school.
Yep. So when you have the adenocarcinoma, it tends to be presented later than the squamous, because the seeds where they start, the disease starts within within the mouth of the womb, whilst the other one starts on the mouth of the womb. Okay. So the 2 scenarios are different. If you on, then you bleed early for you to be detected. If you in, they don't bleed early to be detected. That is it.
Okay. So there are two types broadly.
The bad one doesn't show up
early.
Okay. And then the majority of people, it will show up early, but we don't care.
Like I said, Shingles is a legend, though. Dr. Wechi said
Okay.
he has said it because
Yeah.
you see. Good morning to you, OJ. OJ should come on the show very soon. No, stop hiding. You should come on the show. I'll invite you. Don't worry. Come on the show. Good morning to you, Dr. Mauli Agbemavo. Thanks for doing the listening. Catherine. So Catherine's question is that. Can you ask your guest? Many women during bath time would wash down there. Can they feel it? If can they feel it if the cervix is changing? Interesting question.
Yes. The only sign will be when you touch your cervix and it bleeds. That means I have the disease. Changing doesn't mean anything. There's something called when you give birth, the nature of your cervix definitely change.
Okay.
So now when you have for someone who had given birth, the more birth you have, the more the nature of the cervix changed. So that one is not a good way. But I can tell you, the only thing you need to do is to have screening done. If you've never screened, then for all know, you have cervical cancer. If you are 25 and above, and you've never or you infrequently get screened for cervical cancer, before you know you have cervical cancer.
Okay.
And the one thing I need to add is that when you get infected, it may take, on average, about 12 years.
12 years.
Yes, up to 12 years.
Before
there is let's say, a gross or a disease, or you can see something.
you can see something.
But mind you, it may take a while for it to become what? Clear.
Okay.
Okay. Because even when you have the disease, there are ones that you can't see with your eye, and those that you can see with your eye. And if, let's say, you started having sex, the average age of sexual intercourse in Ghana is about 17.5. Okay. I'm not talking about the skews to the left and the right.
Yeah.
If you start doing that around that time, by 35, okay, you should think about having what? At least one screening.
One screening.
Because now, the WHO, down the global agenda for let's say women health, we're looking at screening 90% of women. Okay. Sorry, giving vaccination for 90% of young girls, screening 70% of them, and treating 90% of them. Let me tell you something. That is up to 2020, let's say 6 years away.
So that's like 2030.
2030. Can we realize that that's the global agenda for women?
Vaccinating 90%
of our girls. Okay. And then screening 70% of them, and then treating 90 of those with established disease.
So this I'm going to do. If you're listening to the show this morning, and you listen, you may run a Sunday school, you may run a school, you may be a teacher, a parent, a guardian. I want you to advance this conversation to other parents around you. Walter Aiden is in Kumasi. They have access to the vaccines in Kumasi. Get your Class 6 pupils vaccinated. Let's start with us, because I always say if you start looking at government, it's never going to happen. So let's start looking at us. Why don't we just decide consciously that we're going to, I'm sure if we're buying the vaccines in bulk, you definitely get a discount. Buy it in bulk, because there are schools in Kumasi that have over 300 people in Class 6. Make it a school policy. These are professionals. They will come, do the necessary education, and give the jabs, because we know that the age of sexual encounter is very, very, very low and keeps going down. So, I mean, now if you drive through Kumasi on the weekends after 9 p.m.,
it's very scary.
It's scary. It's scary. The people you see in pubs and clubs and standing by the road are probably no more than 18 years.
And these are, let me put it, they are let's say, the repository of the HPV.
Yeah, because they are having multiple.
So they have it there, and they will trickle down into, let's say, our
homes,
quasi-normal populations, and then give us problems. And I think that, I mean, that's quite I think that it's something also Orange FM could also have a look at it and see if they can become a hub for these communication, or let's say.
Yes, I mean, so that's why I'm here. And that's why I'm doing this. If you're listening, I'll open the phone lines in about 2 minutes. I just want you to call and tell us that, you know what, you are interested in getting women screened or girls screened. If this takes off, maybe I should do this. If this takes off, let's get the vaccinations done. Let's run a project that in Kumasi we are championing vaccination for girls. Like, let's do it ourselves. Nobody's going to do this for us.
We're not going to.
Nobody. For the politicians and those in power, maybe their kids are probably, they've crossed the age, or even if they haven't, they've got it already. They've got the jab already. And we're just walking around. Because I remember there's a huge campaign on hepatitis B vaccination, which really got going, and then somehow, some way, it died off.
Yep.
Let's not make this happen to cervical cancer. Cervical cancer is one of the things that can rob a woman of her entire life.
You see, if you go beyond that, you see, it's a matriarchal world. Whatever we are as people, women hold the central
Definitely.
point. Raising our kids, taking care of them, and often, I mean, we are virtually, let's say, strangers in our house, in our households, you understand? So just imagine that a woman who is 35, at the prime of her life, is down because of cervical cancer. The kids are going to suffer terribly. Okay. And I mean, the knock-on effects will be on even the performance of these kids in school, the social integration and all kind of stuff. And I think that is something we also need to kind of have a serious look.
This is 107.9 Orange FM, and this is the Orange Health Lounge. I'm just sitting here shaking my head, but that's life. This morning we're talking about cervical cancer and cervical cancer prevention, treatments, options that are available to people in and around the Ashanti region. I don't want to say Kumasi, in and around Ashanti region and Ghana. We have to make conscious efforts to prevent our girls, the future of this world, from succumbing to something that is preventable. Something that is purely preventable. So yeah, let's take the action. So if you're listening and you want to do something about this, you want to say, you know what, I think that we could do this. I'm keen to hear your contributions on the show. 0541 022 318 0541 022 318. That is the phone line if you want to call. Good morning to you, Dr. Catherine Spangenberg, Head of Department of the Family Medicine Unit, and she's a specialist when it comes to palliative care. She's saying that she's listening to the show. Good morning to you, boss. 0541 022 318 0541 022 318. That's the number to call if you've got any questions to ask us this morning about what we have been discussing. 0541 022 318. Yes. Okay. So someone is asking if we can explain further about the self-collection of samples for HPV testing. She's saying that if that is available, or if that were available, because she's not sure if it's available now, how is it done, and are the tests reliable enough?
Yes, when it comes to the there are literature or papers, or people have done it to compare, like say, the specificity or sensitivity of that regarding picking up the HPV DNA in the sample. So long as you're looking out for a DNA, that's a blueprint. Though there could be contamination, doesn't even affect that.
Okay.
But the fact is that you have enough sample from the vagina, especially the upper vagina. The vagina essentially will keep a bit of the foliated, that's the rubbed off from the surface, but it has to be taken such that it's representative. Okay, so when that is done, we'll know the HPV profile, the kind of HPV profile. But the main issue has to do with the bottle. So these are where efforts need to be laid. We will make them available probably at
Water Aiding.
You can pick it and go to your house. You sample yourself and bring everything that you don't want to have, let's say, anyone sample the stuff for you. And
you don't want anybody peeping down there.
Okay. Let's say, I think that it can also be done, okay, let's say, with a cotton bud. I'm thinking about, it could dry up, but it could also
be done. I mean,
yes,
like within a certain time frame.
And then so long as they get to the collection point, okay, it can be prepared for.
Joe is asking a funny question. Joe, this one, don't try. He's saying that can't husbands collect the samples for their wives?
Oh, it can be done. It can be done. It can be done. So long as the sample gets us in one piece, then it can be processed.
Okay. Shout outs to Ohima. Ohima is saying that if men are the carriers, why?
I never said that.
Okay, all right. So, Doc never said. But can samples be taken from men? But we don't have a cervix, so
we don't. But we have a condition that also can occur within the urethra and then on the gland of the penis. All of them are secondary to HPV infection. Okay.
0541022318 0541022318. This morning we're having a conversation about cervical cancer, screening, treatment, prevention, education, all rolled in one. 0541022318. If you've ever screened, I want to know. Share your experience with listeners. People are a bit jittery when it comes to going for even breast screening, which is non-invasive. But if you have done it, let me hear from you, and encourage somebody to do it. Let me pick this call. Hello, good morning.
Hello, good morning.
Yes, your name and where you're calling from, please.
I'm calling from Tech.
Okay, kindly go ahead, please.
Last year I had this disturbance. So my doctor asked me to go for the screening. I went to confirmation. The family planning unit.
Okay.
So they screened me. I went there repeatedly, but I never got the result. That is my problem. Thank you.
Okay, thank you very much. That's a shame. That's a shame.
Is it to do with the fact that the report delayed and then you got frustrated not going back?
But how long should the results take anyway?
Usually for cytology and histology analysis, from my end, and we do it within 2 weeks.
So within 2 weeks?
2 weeks you should have it.
You should have it.
It's all about the checks and balances within the system.
Yeah, because someone has done the test.
And these are so frustrating. And if you really want to roll up and then be seen as a serious group of people, and these are things people need not to complain about.
No. 0541022318 0541022318. That's the number to call. So it's a lady who called from Tech. It's unfortunate, but I mean,
she can come to Water Aiding.
You can come to Water Aiding. They are located at Asokwa. I think
halfway between the mall and then the stadium.
Yes, just halfway, like you're on the right. Beautiful hospital. You can go there, and like Dr. Amo-Antwi said, 2 weeks, you'll get your results to you. 0541-022-318, 0541-022-318. That's the call number. 0541-022-318. That's the number to call if you've got any question to ask. All right. So, okay. So someone says, all right, so if I have done the test for the HPV DNA and I test positive, what happens and what does it mean?
Okay. So, and that is the reason why I'm also opting for the self-testing, because a whole lot of people will test negative, but when it comes out as positive, then I really need to look at whether these HPV strains are causing any changes on the surface. That will entail that I do a pap, okay, or I do colposcopically, and then I will have a magnifying glass with a light, look onto the surface and see whether there are any changes.
Okay.
Okay, so if the HPV test is positive, it then directs me to do few things. Go again onto the surface and see whether you can pick any sign that there is a transition in the normal nature of the surface. So when that is done, depending on what I see, I can say, oh, I will just have to repeat the test in a year. Okay. Or based on what I see, I would say probably I need to ablate or take something away from the surface, which may be something that is telling you that the HPV has done quite damage.
Some damage
on the surface.
So when the test result is positive,
Yep. You need to go through a second test.
Yeah, there are next steps.
Yep. You need to go through a second test, possibly. Yep.
But majority of people do the pap smear.
Yep.
Is that enough?
You see, the pap smear in terms of specificity, intending to pick, let me say, if is it truly negative? That's where the issues are. So if a DNA say you are negative, you are really negative.
That one is definite.
Yep, you are really negative.
Oh,
and
okay.
we want you to repeat in 5 years. Whilst the pap, you need to repeat in 3 years.
3 years.
And then the fact is that when you are negative, your negativity shield can even last for 10 years. But it's not a story we would want to kind of populate, you understand? The HPV DNA testing is quite expensive compared to the pap. Okay? But as a matter of fact, it gives you also a lot of assurance that if the test is negative, you are truly negative.
So if you do the HPV DNA testing and it's negative,
it means that you really.
It means that you are truly negative.
Yes, sir.
But you can do
it's
highly negative.
But if I mean, there's no. You see,
like there are no absolutes.
If it's negative, then it's likely that you really don't have any semblance of the disease on what.
Okay, but if you do the pap smear, you're supposed to repeat it in 3 years.
Yes. When it's negative, and tell you when even the pap is positive, it could not even be the malignant.
It can be a false positive.
It could be infection that is there, but never does that.
So I mean, we're advocating more for you to do the HPV.
And then again, the one who does the HPV, the pap should have certain level of what skill. The
competence.
One who read the slides need to have certain level. So we can do the HPV as a screening to read a lot of the patient that need critical assessment. The HPV can afford us the chance to kind of take a lot of women out of the equation and just concentrate on the positive ones.
0541 022 318 0541 022 318. That's the number to call if you've got any question to ask this morning. 0541 022 318. If you've got any question to ask this morning about what we've been discussing, now is the time for you to just give us a call, and we'll definitely answer your question for you. 0541 022 318. I'd love to hear from you. Yes. St. Anthony of FWACS sent another message, and he's saying that. Hello, good morning.
Good morning.
Your name and where you're calling from, please.
Jamasi.
Pardon?
Jamasi.
Okay, kindly go ahead, sir.
Anthony. Hold on.
Pardon?
Your call has been put on.
Okay, so he put us on hold. 0541 022 318 0541 022 318. That's the number to call if you've got a question to ask us this morning. So someone is asking that he heard that cervical cancer is sexually transmissible, and he's asking if a woman can get cervical cancer from sharing a toilet facility.
That's a baloney.
That's not true.
That's not true. Cervical cancer is not transmissible. Okay.
So, St. Anthony, you won't get it from
Your wife.
Yes, like using a shared bathroom facility. Please, you won't do that. 0541 022318. And for those who are asking about, how to get in touch with Dr. Amo-Antwi, so he's given a number for Walter Aiden Hospital. I will share it with you. You can call them. For those who are wondering, if they need to get their kids vaccinated or they need to get themselves screened, I will announce the phone lines before we leave the show, and I'll also post it on our Facebook channels so that you can just get help. You can just get help. It's important that we also point you and we signpost you in the direction where you can get help. 0541 022 318 0541 022 318. That's the number to call. Doc, so someone is being a bit statistical.
Okay.
So he's saying that, do we have any data to show that in Ghana, when somebody gets the HPV DNA testing and is negative, they are able to live longer? And
if you're negative, means that you are not under the umbrella of cervical cancer and its issues, or let's say other cancers that are, let's say, caused by HPV. If you're negative, you're negative.
If you're negative, you're negative. Good morning to you, McDonald. McDonald is sending us a message all the way from the US, and he's saying that his sister in Ghana got the HPV testing done, and they said it was precancerous. He's non-medical, and he's saying that, please, what does it mean? Because this was just in December.
So the pre-cancer leap.
Hold on, let me pick this call and we're going. Oh, it's gone. Sorry. Please call us back. Sorry, I just missed it. 0541 022 318. So she got a testing and they said it was precancerous.
Okay, so if it's pre-cancer, then it means that we need to kind of deal with that lesion. Either we will want to ablate, sort of use heat or cold to wipe it off or to scrape it off. Okay. But not all of them are treated that way. Some of them we just have to observe because, let me tell you, if you have that infection, okay, that is translating to that cytological change or changes on the surface. Majority of women within 2 years, the disease or the changes goes off.
Okay.
So we need not to over-treat them as well.
Okay.
If you have the lesion, we can follow you up.
Okay.
Not that all precancer treated, no, not all of them.
Not all of them.
Not all of them.
Okay.
We have science-specific indications for us to kind of treat you. Okay. If the changes are, let's say moderately severe or highly severe, then we have to maybe.
Good morning to you, Tony. Tony, thanks for doing the listening. It's great to know that you're listening. Good morning to you, Dr. K.K. Hussein. You are the medical superintendent of Menchia Government Hospital, and you're also the president of the Medical Superintendents Group, Ghana. Doc, we have to invite Dr. Amo-Antwi to our next meeting because I think that the hospitals within the Ghana Health Service have a huge role to play. It's good to know that he's listening. Good morning to you, boss. I think that we have a role to play as hospitals within the region to advocate for some of these things, especially the vaccination.
The strange bit has to do with, let's say, harnessing our resources within Kumasi, because if my memory serves me right, in the last 4 years, there's a Cancer City project.
But that Cancer City project, we haven't heard about it before.
We call it the C-SPAN, or the C-SCAN. Okay. It's between KMA and then Konfonochi, and I guess all the catchment population. But if we as well, the players, majority of the players of cancer care in Kumasi, I'm not even aware of that. The next thing has to do with the fact that it looks like we make annual noise. Yes, we make annual noise.
I like the expression. We
yes.
make annual noise.
Okay, and I've heard in certain quarters that's the way some of the big shots will make a bit of
money.
You understand? And I'm very picky when it comes to even where I need to stand and then talk about these things, because at the end of time, people are also trying to kind of have a bit of this NGO thing going on to also meet their own selfish gains. We are the pillars of the healthcare.
Okay.
Those times when we're, medical student, young doctors, but sincerely, we are training the next cohort of people to man the health system of Ghana. And that if we tell them this is what we want to do, I guess majority of that, knowing that we are involved with them, they will what? We can sideline government. Yeah, we can. And you see, when it's, we engender certain quests, or let's say tests to have these things fixed, looking at what we've been able to kind of come up with P6 or GH1, or let's say everyone who is 25 and above at least have one test done by age 35. If resources become available, repeat it in the 10 years. You see, our target is that, are you adequately screened as yourself? Adequately screened means that you're 25 and above. In the last, let's say, have you had 2 consecutive tests that are negative with HPV? Or do you have 3 consecutive tests with pap smear that are negative? If you've never done that, it means that you still run a risk of cervical cancer.
0541022318. Good morning to you, Dr. Maxwell Amo, from the Kolebu Teaching Hospital Family Medicine Department, saying that you are enjoying the show. You're in Kumasi. I'll see you after the show. Let me pick this call. Hello, good morning.
Hello.
Yes, good morning.
Yeah, my name is Bibi Boy. I'm calling.
Hello.
Yes.
Yes.
I have some story. I want to ask the doctor.
Go ahead.
On herbalist, on Nectar system, he saying that when the girl, you don't have anything, but the breast is correct. You don't have any sickness in the breast. But you won't have sex. He didn't give the breast in house bound to massage it. But one day, sickness cancer, But the herbalist, what can say? When you won't have sex, give the breast for your husband so that they will massage give it to you. But the doctor said, I said no, that's my question.
Thank you very much for your question. 0541-022318, 0541-022318. Over to you, boss.
If I get the intent of the question, that would lie with maybe doing examination of the breast during the sexual intercourse. I've heard that people are making stories around, but I don't see how effective these things are. Okay, there's always a comic relief anyway.
0541-022318. People will say anything to get away with doing something hanky-panky when it comes to some of these things.
The unfortunate bit is that, let me put them in a group, the unorthodox medical group, including the herbal. I doubt whether, they have their limits when it comes to these things.
No, they don't. Our system is very lax to the point where someone who has little or no knowledge about the pathophysiology of what is happening to the patient.
But they will tell you that is school.
Can just grind some things together and give to somebody over years.
But you can see the signposts around regarding the
everywhere,
analysis.
Everywhere.
Them are duty.
Everywhere.
And you, as a qualified doctor, cannot.
You can't put up a signboard.
Yes.
It's painful. 0541022318. I'm speaking to Dr. Amo-Antwi, legend when it comes to, gynecology and obstetrics. Like when you go to Konfanoche and you say Dr. Amo-Antwi, people may not know who he is, but if you say shingles, everybody know who he is. The first man I know to wear multicolored socks. Before it became a trend, he's the CEO of Walter Aiden Specialist Hospital located here in Kumasi at Asokwa. Like I keep saying, beautiful hospital. You have to go there to experience the kind of service that they do. They offer a wide range of care, and he's a prime advocate when it comes to cervical cancer screening, education, awareness creation, and more importantly, prevention and treatment. More importantly, they have all the stuff that you need. Like he says, cancer does not need to queue. Cancer does not need to queue to get a treatment. If you entered any cancer treatment center
you are queuing
in the city,
please come.
There's a long queue.
Just come second opinion.
There's a long queue.
If there's a queue for you to get treated for any of the cancers, please come to come to
Walter Aiden. Just keep the queues and go to the people who also know and have the the know-how to get the treatment you want. 0541 022 318 0541 022 318. We're approaching the 10 o'clock mark where we round up our conversation. So if you want to join us, 0541 022 318, that is the number to call. Okay, so someone is asking a very interesting question, and I think I side with you. So his question is that why is it that regular, so quote unquote, regular hospitals, regular healthcare providers are not talking to people or offering cervical cancer screening opportunities for people when they visit them for routine care in their facilities? He's asking whether it is because they are not abreast with current knowledge, or it's because cervical cancer is not as interesting as breast cancer.
I said, as I intimated in the early part of our discussion, it has to do with the interest and policy-driven, initiatives on these things. I can tell you, from the district hospitals up through regional hospital to teaching hospital, there are formidable knowledge on cervical cancer control. And we also running through some difficulty as a nation. Majority of our middle cadre officers are out of this country.
Yeah.
And it's increasingly becoming, let's say, an audios tax.
Yeah.
So we for whatever resource that we have now currently in the country, whether by purpose or design, we need to kind of come up with strategies to kind of fight this. But at the end of time, I think that the government, being the sole policy implementer, should be able to kind of be up with their game. I always say, look at the number of V8s around. If we sacrifice 2 V8s every year, we should have a lead in our cervical cancer. Okay.
0541 022 318. There are a lot of government officials in town today because the NPP is going to the polls today regarding their parliamentary primary results. I do hope that some of you,
they have to listen.
Yes, I'm sure as you guys are whizzing around the country and the region, take some time, please. Just take some time. Listen to what we're saying. It might be noise, but we beg. Listen to what we're saying and consider it in one of your... You see, one of the things that I struggle with in the Ghanaian health and political system is that you cannot point to a single member of parliament and say, this man, this woman
championed anything.
Champions this.
Within
So if I have a health thing that I want to push, this is the member of parliament to contact.
You see, increasingly, I feel strongly to become apolitical in a sense that politics should, to me, never appeal to the technocrats. People who are visionaries, they enter, and then in the next minute, they are
It's the money.
to me, Charlie, I always feel, and that's the reason why, not as if I'm against the establishment, but the fact that the truth need to be told. I've seen a lot of women come, Dr. Miwu, Dr. Pat, the next minute they are gone. We can't even get essential facilities to treat these cancers. Mind you, as we said, and we keep on saying, cancer can never wait in a queue to take a turn at treatment. And that should be something that's so scary. If you come to me that I say you have cancer, you need to have radiotherapy, and go to Kolibu, machine is not functioning. You come to Komfanoji, machine is not functioning. It means that inadvertently, you are on a death warrant.
But
why should it
but
happen?
Why is it that these machines break down so quickly?
You see, Africa and our ill maintenance, attitude. And I can tell you, listen, I'll say them as they are. You look at, I have a senior who has been, having a CT scan facility. Okay, it never breaks down. Is it to do our procurement law? That makes our let's say this high level let's say kind of say you don't understand. CT scan breaks almost down every other day. LINAC, my external radiation setup, is not functioning, and I can tell you, you can own it as a private person and it functions every day. Is it to do with that we're sick as people?
The public one that does not function.
Doesn't function.
We are 10 minutes from 10 o'clock here on Kumasi's Music Leader and on your number one radio health talk show here in Kumasi. We've been talking about cervical cancer awareness, education, signposting you as to how to get screened, how to get treated. And we've been advocating strongly that, there should be a catch them approach, which is class 6. So that at that point in time, vaccination.
So that whole cohort of
that's a
generation
huge
is
number.
aware that there's something called cervical cancer. Before they start having sex already, they have soldiers to fight every disease-causing or cancer-causing organism that come to them. The next thing is that if you're 25 and you've never gotten screened for cervical cancer,
you should.
Is an issue of what a necessity.
Ekua is saying that. Tell Dr. Amo-Antwi to run a promotion. Well, someone is saying, run a promo for people who have never been screened. Run a promo for people who have not been screened. Please, let me advocate. I'm advocating, if you've never been screened, go to Water Aiding.
So
also run a promo for you.
I think that what we need to be doing probably, I may have to kind of buy another time. We get something rolling for the next month.
Yes.
Okay.
Let's just do a promo.
Yes.
Because February is
it really does
love month.
Yeah. Yes. There are a lot of what you understand.
Yes.
So anyone who want to have a nice Valentine with you, at least the ticket should be pap smear
and HPV DNA
test should be inclusive.
Let them, as they are buying you the flowers, the chocolates, and all those things.
Get you a ticket for
screening.
HPV screening and
yes.
Water Aiding.
Just do that, and I think it's a very good thing, isn't it, guys?
Yes, you can have a look at that.
Yeah,
Valentine with an HPV test.
That's nice, isn't it? That's very, very nice. Question from Kole. Kole is asking that, does using condoms for men prevents transferring HPV to women?
Yes, it's one of our modalities for preventing HPV has to do with wearing condoms and wearing them appropriately. If you wear a condom and then get them soiled up at the point of, let's say, the tumescence or when the thing is flaccid, and to me that is not. But wearing the condom and wearing it right,
wearing it properly,
yes, it's very effective in preventing HPV, and in that matter, all sexually transmitted. Majority of the sexually transmitted diseases.
Okay, good morning to you, Adele. Thank you for doing the listening. You're saying that you've enjoyed our show thoroughly, and it's recorded on YouTube. It's recorded on YouTube, so just go to YouTube, like and subscribe to our page, Orange1079. Just subscribe to the page. You can watch the show all over again. Take your time and make notes, because you say that you're a nurse and you want to do some effective public education for your parents when they come. And she's asking that since nurses or midwives do a lot of vaginal examination, she's saying, can you screen the cervix at delivery?
Perfect. This is so thought-provoking, you understand? If you afford, if you do vaginal examination during it, yes, we can take a swab, put it into, let's say, a receptacle, put them, and then it can be worked on.
Okay.
Yes,
okay.
It's a very good way. We can also look at that from an angle. Every woman in labor can be given a HPV test.
HPV tests. Yeah. So Adele, I think you're onto something. So
That's important.
It's the opportunity to make sure that there are opportunities for people to get screened.
Yeah. Yes.
To create the opportunity for people to get screened. When you're going for any...
And the lovely bit about the Gene Expert machine for TB control. This can run a parallel program regarding the screen of cervical cancer.
It can be used for...
Yes, it can be used for... All that you need to probably... the antigen antibody conformation need to change. Probably need to change the cartridge or something like that. And you see, there are over 130 platforms within Ghana that is part of the
Gene Expert.
The TB control program.
I have one in my hospital.
Why can't we do HPV tests with that?
We don't have the cartridge. So it's about getting the cartridge.
Yes. And you see, that's all about policies.
This thing is not rocket science. So.
No.
Because we changed the cartridge for COVID.
Yes. Change the cartridge, make it HPV specific. That is it. We are good to go. And then look at, to me, I think that all that I need to do is to kind of brighten the corner that I am. Politicians don't listen.
They can't be bothered.
They are not bothered.
It's for them. It's a 4-year cycle of voting.
Vote. They don't care, because if we have a program, you see, the expanded program of immunization is superb for Ghana. We can.
It has room to expand.
Oh, mamma mia! For those that are already doing the vaccination for the cyst killer disease and all that, these are all avenues for us to do HPV tests and cervical cancer screening. It's marvelous. Already, are there even health education programs for elementary kids? There is. How are we in liaison with what the expanded program of immunization? The same way. So let's look at the pedestal of what the TB control program. Let's do that expanded program of immunization, and then possibly we mob up, and that is it. We don't need anything. Gavi can come along. Nigeria just taking a delivery of the Gavi vaccines.
Okay.
Why can't we do that as a nation?
For cervical cancer?
I'm telling you, Rwanda is like 4 years ahead.
So why can't we just copy what they are doing?
Because the more important thing to us is who becomes a flag bearer and who takes the parliamentary seat. And
if it's been done,
yes,
it's just a matter of copying it.
And I'm telling you, I can stand anywhere and say them as they are, in a sense that the people who are in affairs of our country are our contemporaries, our mates. And we are people of comparable levels of intelligence. You can't be smarter than Kwabena Amo-Antwi.
Never.
No, you can't be smarter than Kwabena Amo-Antwi.
That's one I can vouch.
You understand? And you realize that it hurts. It hurts. Because it looks like there are a lot of irresponsible thought ideas and things and how things need to be done. And even to the extent that people are, raising their hands up.
Yeah, because people are tired because they keep pushing and pushing and pushing, and nothing gets done, and then they just get tired.
Yes, but I'm not going to do that. I realize that I'll have more control in having an establishment, and I'm telling you, with few people, and then I know they will help. I'm setting up a full-blown cervical cancer center in Kumasi within 5 years.
A full-blown cancer center.
Where we will treat everything in a sense that we are people. I mean, I've been able to gather like minds, and everyone is I mean, the niche pin within that field of specialty, whether radiation oncology, medical oncology, I mean, internal medicine, and these are things. You see, cancer treatment is always, like say, multidisciplinary.
Yeah.
Okay, so we are setting out a multidisciplinary team which is already there. So you can come there. The multidisciplinary team can treat you for internal medicine, diabetes, hypertension.
Like a one-stop shop.
You
Everything
understand?
happens.
Yes, and we create a